Brisbane North Partners in Recovery is seeking to develop a regionally suitable model for a safe space alternative to hospital emergency departments.
We wanted to undertake this research, to commission this research to find out what would be a model for safe spaces for North Brisbane, and that could include a number of different models. The data that we've been provided with by the Metro North Hospital Health Service says that about 36,000 people between July 2013 and June 2015 presented at hospital emergency departments in North Brisbane with psychological distress. And of those 36,000, the average length of stay at an emergency department was about 3 hours, and 79% of those people were actually discharged without being admitted to hospital.
People in psychological distress don't always need or want to be in hospital or to go to an emergency unit. Some people need alternates to those spaces. This project is about having a look at what are those alternatives out there, what could they look like. Sometimes it could be some people need and are looking for a place to go, a physical location to go, while other people, it's about having someone go to them. It might be peer support, it might be some sort of other psychological supports or an environment that are safe for people.
So I know there's a lot of different models around what type of actually safe space would look at, and I think all of them are quite credible, but I think you need, like I said, a multifaceted approach for what safe space is.
I think what we know is that nobody will choose to go to hospital if there was an alternative. I think the reason people end up at emergency departments is that most services are Monday to Friday during business hours. They're not extended hour services. There's no concept of warm line or support lines to ring. And sometimes people need more than that. They actually need the physical presence of another person. It's not necessarily to undertake any clinical work. It's actually the presence of another human being in their lives.
People who are in a situation where they need support and they need it fairly urgently often will go to an emergency department. So within North Brisbane there are a number of places where people can go, and a lot of the time it's not really the right sort of response.
For my own personal experience, when I started to become unwell, I didn't know where to go, and I was frequently presenting to the hospital.
I tend to get anxious about my suicidal thoughts, so it's like what I do most weeks is find somewhere. I just found that a safe space for me just meant being around people, so trying to go somewhere where I'm not being a bother to someone, but I know that I'm not going to commit suicide in front of others.
And I also think that a safe space could also be incorporated in hospitals or GP offices, having people who are available to talk when people are in crisis.
I think it would need to be clinical and non-clinical. I think it would need an element of peer support, whereby people would be able to access information on other services and even referrals if necessary.
Who is a safe space response for? It's for people who present at emergency departments in a state of distress, people who don't present at emergency departments yet who need a safe space response, and people who already seek a range of safe space responses through relationships with people and places.
I think it's important that we ask people who have experienced psychological distress, mental illness, mental ill health, what they want, how they feel about what's needed. Because I do think it's really individualised, and one size isn't going to fit all for this kind of solution.
So looking at more of an integrated approach to healthcare within a community setting. So working with other service providers, whether it's the actual government providers and NGOs, but also that function from an after hours capacity, so there's people there.
I think it needs to be an approach, I guess, more than necessarily a facility or a set of bricks and mortar. I think there needs to be lots of options that people can then self-select for themselves based on where they are at the time, what option might suit them better.
I don't think it's a one-size-fits-all solution. We've got a lot of resources within North Brisbane. So really the solution, I think, is how we best use the resources and the partnerships that are already in place. Use that as a start, and then think about what we need to do differently on top of that. People, of course, are dispersed right across North Brisbane. It's a huge geographic area. So we can't be relying on just a small number of centrally located facilities.
However, if there had have been a safe space environment where I could have just gone and spoke to someone face to face, or just chilled out while I was flustered, while I was going through panics, while those things were happening, I think it would have been more beneficial and probably a little bit nicer for Bub as well.
Depends really in terms of what I need to do. Like if I'm I am anxious about it, but if I really think that I'm very close to going from thought into action, then I might go to somewhere like just go and sit in the emergency, not talk to anybody, but just sit and say there are doctors. And yesterday I just sat and had a cup of coffee, in the hospital.
I think that it's subjective for most people. You know, while you're unwell, and you begin to learn, or I began to learn, what things worked for me and what things didn't. You know, and sometimes that's hit and miss, and that changes.
I think the response needs to be something which is broad and inclusive to many different services. I think a team-based approach that's a multidisciplinary approach, which is quite possibly embedded in existing community centres and other services where people tend to frequent and attend now in points of crisis. And I think it's about the collaboration between the existing services to better support people in those spaces, and obviously resourcing those spaces better with trained staff, and obviously referral points, possibly even some brokerage to support people and transport services to help people.
Given the range of expressed needs, the volume of people presenting to emergency departments, the importance of individually tailored responses, and the diversity of geographical areas involved, this report concludes that a regional safe space strategy is a way to promote existing options and develop responses to service system gaps.
A regional safe space strategy will harness leadership, make best use of existing infrastructure, and include centre-based and outreach responses. There will be a role for clinical and non-clinical staff, peers and volunteers. Individual safety planning within support plans will be more widely adopted. Frequent presenters to emergency departments will have access to ongoing support to address their various needs. A safe space regional strategy will have scope for innovation and will embrace robust evaluation as a basis for continuous improvements.